2 likes on Tinder. Girl.
Let's see him.
So we have this guy, totally hot.
Oh yeah, he's a babe.
But he just seems so stupid, and he's a total frat boy.
Okay.
Partying, always drinking. I'm just, I'm trying to like really be smart about how I make my choices lately. And then this is the other guy. I mean, not as hot as the other one, but I mean, he has a good job. He's financially stable. I mean, he's so put together. So I just feel like it's time to make better choices when it comes to dating.
Yeah, we're not 19 anymore.
I know, girl.
It's time to look towards the future.
So I guess I'll give this guy a try.
Okay.
Okay, so what Jamie showed here in this skit was showing more rational thinking as a young adult, which is according to Piaget, we're making more rational judgments. That's why she wanted to pick the guy who had more things going for themselves, possibly. Also, according to theorist Havigerst, many young adults are now looking for partnerships, marriage, so that goes and shows you why she was using Tinder, looking for a mate. Right, so the next skit you're gonna see is on physical development, and the patient and doctor will be in a doctor's room.
Hi.
Hi.
So I'm here today because I'm turning 30 and I feel like my body has just been acting weird. I've been putting on weight in weird spots and I can't eat what I used to eat. And I'm just nervous about turning 30. I don't know what else to expect.
Well, Naomi, you're still in that young adult stage, which is from 18 to 34. What you're experiencing is normal, so please do not be alarmed. What you can expect is that, you're gonna have a loss of muscle mass, and your kidneys begin to filter blood less efficiently.
Okay.
So don't be alarmed. This is normal.
Okay.
So what you can do though is you can continue to exercise and eat properly. Okay.
Okay.
Do you have any more questions for me?
No, that really helped out.
All right. Thank you so much.
Okay, so according to theorist Roger Gold, a lot of young adults from 18 to 34 go through a lot of periods of question and re-examination. So that shows when Naomi is worried about her changes that she's experiencing, which is very normal. Also, according to Havigerst, they're also trying to accept their body. So clearly she's trying to take responsibility of her health. So that's what that was showing there. So the next skit we're gonna do is diet and physical development, and that's gonna be in the waiting room area.
Hi, may I have Elise Schow?
Yes, that's me.
Hi, I'm Dr. Reeves. How are you?
I'm
You can
good.
follow me to this room.
Okay. Here you go. You want to sit here?
Yeah. So what's been going on?
I just really want to come in and talk to you about some things. I'm trying to get more on track with my body. Because I used to have some eating issues where I wouldn't really eat properly. I wouldn't eat full meals because there are things in the magazines and social media that made me feel like I really needed to thin down.
We all compare ourselves. I feel like everyone goes through that phase, and that's totally normal.
Okay, yeah. And so I wanted to talk to you about some of the things that maybe I can do and see if it's right with you.
Okay, yeah.
Because I know some people like to get this perfect body, the flat abs. I've heard of them exercising about 7 hours a week. Is it all right if I am only exercising 30 minutes a day?
That's
every day?
perfect. That's that's normal and that's expected. You're putting forth some effort and you're incorporating that exercise in with your day-to-day.
Yeah, definitely. And then another thing that I was thinking about is I know fast food is always upon us, and so I try not to eat that because it's so high in saturated fats. And so whenever I can, I'm trying to eat a salad, but then again, it's trying not to eat the tiny portions, just lettuce,
Yeah. I totally get
And
it.
so I've been thinking to be healthier, that I should probably add all the toppings chicken and nuts and seeds and maybe even some berries too.
You are on the right track, Elise.
Okay.
You're doing excellent. You just have to keep this up. Continue to eat right. Continue to exercise every day or 30 minutes a day. Just put forth some effort,
Yeah,
and that's all that you can do.
definitely. All
It
right.
was so nice
Thank
seeing you.
you.
Thank you so much, Elise.
So far throughout the skits that we've been playing, we're just trying to portray the necessity to like acknowledge what young adults are going through. So in nursing, it's important for us to understand their concerns. A lot of them are concerned about finding partners, building a marriage and family, maintaining their health, and things like that. So that's what we've been trying to show here. And the next skit is going to be a young adult who's just entered adulthood, so about 18, 19, who's visiting the doctor with her mom.
Hi, Mom.
Hi, may I have Lily back?
Oh, she's right here. She's right here.
You don't
Come on,
have,
honey.
you don't have to come.
Baby, come on. Come on, stop doing this.
Okay, well, Miss Lily, I do see that you're 21. Are you okay with having mom in the room?
Of course she is.
Not really, honestly. I would
Lily.
I would prefer if you waited outside.
Sweetheart, are you sure?
Yeah. I think I can
Okay,
handle this.
I'll be right there if you need me, okay?
Okay.
You don't hesitate.
Thank you so much, Mom.
Yeah.
You're welcome. So Lily, what's been going on?
Well, I haven't really been doing the things I should. I've been engaging in some risky behavior. You're not gonna tell my mom this,
Oh,
right?
absolutely not. All patient information is confidential.
Okay. So basically, ever since I turned 21, I've kind of been drinking and smoking and partying, and honestly, I think I have an STD. I kind of just haven't been feeling right. I know it's risky behavior. I know that, once you get older and that there's all these decisions to make, I haven't really been making the right ones. I just want to know, like, what can I do from this point on to make sure that I'm taking care of myself? I just don't know what to do from here.
Okay. So thank you for, being responsible, coming out, trying to get information on how to get help, that's a great start, So what I'm gonna do is I'm gonna bring my nurse in here, okay? And the nurse is gonna explain everything, and she's gonna walk you through this whole process, okay?
Okay, thank you.
So much, Lily,
Thank you.
and you're doing great.
Thank you.
All right.
Alright,
Hi, come in.
hi, okay, so do I have a Miss Lily Palmer? Is that correct?
Yeah.
Yes, alright, great, so the doctor did tell me that I do have to set some appointments for you. Okay, so the main thing is that I'm gonna set up an appointment for pap smear because you are 21
Yeah.
and you are engaging in sexual behaviors, okay?
Mhm.
And then the second thing I need to just educate you on is a breast self-examination.
Okay.
Alright, and it is just to check, just to make sure that you don't have any lumps or bumps in your breast, okay? Do you know how to go about performing that, or
I think I have an idea.
you have an
Just
idea?
kind of like massaging and feeling.
Okay, alright, great. And I do notice that you have had some sexual partners in the past, okay? So I would recommend you going ahead and letting them know about performing a testicular self-examination just to make sure that they're in tip-top shape, okay? And another thing is that we are gonna test you for STDs, because it is listed on your, as an order, but before I do that, I am gonna provide you with some condoms, and then we're also gonna look at some birth control options too, okay? And one last thing is that, I highly recommend that you get a skin screening just because you are more outside and in the sun and things like that, okay?
Okay.
Do you happen to have any questions for me?
No, that was very helpful.
Oh, okay,
Thank
alright,
you.
great. So, here, I've written up your appointment, here are your appointment cards.
Thank you.
If you have any questions, you can go ahead and give us a call, and then we'll just guide you through it, okay?
Okay.
Okay,
Thank
alright,
you.
great. Have a great day.
You too.
So what you guys just seen in this skit was something that's very important in nursing and all healthcare practice is to assess young adults, but also other age groups about drug use, protecting yourself during sex, and things like that. So it's important at every patient visit for us to assess their use of drugs and alcohol, or if they're using condoms and birth control and things like that.